Public health leaders announced a big expansion of the narcotics diversion program today.
WGN's Brona Tumulty has a story from the West Side where that program already has been having positive results.
Good evening, guys. Yeah, the program started 3 years ago at the 11th district right behind me here on the west side and has since expanded to 11 more districts. And during that time, more than 700 people have been diverted away from the criminal justice system and into treatment programs. Now the hope is to expand that program across all Chicago police districts by the end of the year.
All given a second chance and the resources to help them create a sustainable future and a safer, healthier city for all.
Deputy Chief Antoinette Ursitti announcing the expansion today of the city's narcotics arrest diversion program, set to be rolled out citywide by the end of the year.
Individuals who are arrested for drug possession and meet the criteria for this program are offered substance use treatment in lieu of criminal charges.
That criteria includes things like being over the age of 18 and arrested for possession of 1 gram or less of substances that include cocaine or heroin. The program is run in conjunction with the Chicago Department of Public Health and community-based recovery services.
Where the major problems of this land are in the areas that have high economic hardship. There's been a lot of concentration on the west side.
That becomes more evident when you look at the areas that have seen the most opioid-related deaths over the last 3 years, with the majority of fatalities found in the 60624 zip code. That's within the 11th district where the program began in 2018. Since then, it's seen a lot of success.
Since the program started in July of 2018, we have had more than 700 individuals access treatment and recovery services.
Getting medical help for those hundreds of people means police resources can be better used.
If their primary issue is related to substance use, are there creative ways that we can learn from other communities and be able to keep the really important law enforcement resources focused on prevention and response to crime, especially violent crime?
But in the midst of a pandemic, overdoses have spiked.
But just last year in Chicago, there were more than 1,200 fatal opioid overdoses. That's more than a 50% increase from the year before.
The hope now is if a citywide approach worked with COVID, it can also help tackle this.
We are focusing on the areas and the needs and really trying to work in an all-city approach to this problem as well.
Now, that press conference was held today at Thresholds, which is right up the street, and it helps provide services to those dealing with substance abuse. The staff there demonstrated today how they use naloxone to save lives, and some of their staff actually hold hours here at the 11th district, and when they're on site they can provide those naloxone kits to the public. The goal, though, is to make them more accessible citywide, with the hope being that before the year is out, if someone needs one of those kits and goes into any district across Chicago, either the officers there can help directly or can connect them to someone who can. We're on the west side. Brona Tumulty, WGN News.